Hello and welcome to the Queen Elizabeth Patient Podcast. I'm coming from the Proto building in Gateshead today, and today we've got the lovely Pauline Connelly, one of our resident breast care nurses from the Queen Elizabeth, and today we're going to discuss endocrine therapy, which is basically the posh way of calling Tamoxifen or Letrozole. There's also another tablet in the same range called Arimidex and Exemestane as well, but the two main tablets do tend to be Tamoxifen and Letrozole. So Pauline, with your wealth of knowledge, can you just give us a little bit more information about why a lady might be offered a tablet like Letrozole or Tamoxifen?
Thanks for having us again, Caroline. So if we go right back to the beginning, to when a lady or a patient is diagnosed, there is a core biopsy taken, and most people remember that. And at that point, our colleagues in the labs, the consultant pathologists, can do a lot of work on that biopsy. So first of all, obviously, they diagnose the cancer, but they also then do some special chemical investigations on that biopsy, and that establishes whether the cancer will respond to the female hormones, estrogen and progesterone, and also another marker on the cancer, which is Herceptin. But today, obviously, we're concentrating on the estrogen. When the doctors in the labs look at the biopsy, they will see whether the cancer responds to estrogen and another marker on the cancer, which is a HER2 marker, and this helps to establish appropriate treatment. So for today's talk, we are looking at the estrogen marker, and most cancers are estrogen positive, and what that means is, and we don't know why, but the estrogen in our bodies helps to increase the risk of a cancer growing, but this actually helps us in treating cancer because we have the tablets that we've already mentioned that suppress estrogen in the body and therefore help prevent the cancer from coming back.
So basically, it's a bit like the light switch. What is the light switch that's turning on the cancer? And I think when we understand a little bit more about the light switch that you've just been talking about there, then it's quite confident to know that some patients that potentially we can switch it off with these tablets.
Yes.
So some ladies will ask, why would I be able to have Tamoxifen but not Letrozole, and vice versa. So could you explain a little bit about why some ladies would be started on Tamoxifen and why some ladies might be started on a tablet called Letrozole?
The main reason, Caroline, is basically whether you're premenopausal or postmenopausal. So if you're still having regular periods, it means obviously you're premenopausal, and we need to give Tamoxifen because that mainly works in the ovaries and it will suppress the estrogen in your ovaries. However, the other medication you mentioned are appropriate for postmenopausal ladies, and that is because it works in a totally different way. It's quite a complicated chemical process, but basically as you get older and your ovaries stop producing estrogen, your body's very clever and it accesses estrogen from mainly fat in the body, and there's a special enzyme that helps to convert the estrogen from the fat to be accessible, and the other medication helps to suppress that mechanism. And that's why if you're premenopausal, the tablets such as Letrozole and anastrozole will not work in the same manner. So if a lady who is premenopausal, for instance, can't tolerate Tamoxifen, we can swap the medication, but it becomes a bit more complicated because we then have to switch off her ovaries before the tablets such as Letrozole will do as good a job.
So Letrozole, a lady has to be postmenopausal to take that tablet, and Letrozole does tend to be the gold standard, but it's a bit like antibiotics in some sense that some ladies, maybe their tolerance is different to other people, so there is other tablets that possibly we could trial on if a lady was finding it difficult to deal with the side effects of Letrozole, because these tablets do come with side effects, don't they? And I think in my experience a lot of ladies take these tablets and are fine, a bit like antibiotics, but there's some ladies, we're all very made up very different, have different sensitivities to this as well. Could you explain a little bit more about the side effects of the tablets that we've been offered the patients?
Certainly. Well, initially, as you say, we establish pre or postmenopausal status, and at present Letrozole is the first tablet of choice. A lot of the reasoning behind that is the latest studies have found that Letrozole can benefit ladies remarkably well. However, what tends to happen several years on, there's a new study and perhaps the other sister drugs come up slightly more advantageous to take, but on the whole, they're all very beneficial. And if one of the sister drugs, such as exemestane or anastrozole, are more suitable for a lady and they can tolerate it, then they are better off taking that drug than a tablet there where the side effects are having a detrimental effect on their daily living. Saying that, sometimes it can be down to the manufacturer. So it's worth noting that if you take Letrozole, for instance, and you've been quite well on it, and make a note of the manufacturer on the box, and sometimes it can just be down to a subtle change in an ingredient that one manufacturer may have in their tablet mix than another manufacturer might not, and it can be something as simple as that may help to reduce the side effects, or it can be the time of day you take your tablet that can help with reducing, say, the sleep disturbances.
Sometimes it takes time though, doesn't it? So if you are going to do the changes, it's probably recommended that you give it time.
Oh yeah.
To allow that body to make that change. You find it difficult to take it at night. If you are going to make the switch to the morning one, it's going to have to take time before you would see the difference.
We would recommend really you take it for several months, a minimum of 3 months before you'd see some benefits from switching the time you take it, or even starting the tablets. Sometimes you can start the tablets because it's quite a shock to your system. It can take approximately 3 months before the side effects can settle.
Because it's when ladies start taking the tamoxifen, they may have had regular periods up to that time as well. Sometimes in my experience I found with the premenopausal ladies taking the tamoxifen is that the periods might cease for quite a while, and then all of a sudden they get quite a large bleed as well. So this is one of the common side effects with the tamoxifen. One of the other things I think with the Letrozole, remember Letrozole is given to postmenopausal ladies, and the definition of a menopausal lady is somebody that hasn't had a period for 12 to 18 months.
I think technically yes. However, if a lady has had them sporadically, and some people think, I haven't had a period for 6 months, I'm through the menopause. Unfortunately, isn't that simple? In the perimenopause can actually last for 5, 6, and some ladies it's lasted for 7, 8 years when they're literally having 1 or 2 periods a year or 1 a year. So if that's the case, we would often do bloods to check the menopausal status. But on occasion, if you do take Letrozole or expect it to be postmenopausal but do have a bleed, then we would have to investigate that, and the GP would refer you into the gynae team.
So you would recommend that a lady would report that if you has had maybe a period for a year, then all of a sudden has a bleed, it's worth ringing up and just
checking. Yeah, any queries like that, we would recommend you contact your breast nurse in the first instance. Like you say, that's one of the most common sort of side effects, where your periods, if you're premenopausal, can become irregular, or some ladies say there's no difference, but any change in your pattern, it's worth checking with your nurse specialist. And as you mentioned, Caroline, there are a few side effects. Some ladies will have no side effects, and unfortunately some ladies will have a few, but it can be very similar to the menopausal symptoms really. So some ladies will have hot flushes, the sweating, you can have disturbed sleep. One of the symptoms that isn't spoken about as much, because I think partly it's a bit embarrassing, partly it's because we're British and we don't like to talk about it, but you can have a reduced libido, but also that can often be linked with the fact that you can have some vaginal symptoms, and you can become very dry and sore, and that can have 2 effects. It can affect sometimes going to the toilet to pass water, but also it can affect your ability and discomfort of having sex. And we have some different gels we can recommend and creams to help relieve those symptoms. So anything that we do recommend, that you please contact us. Like I say, it's something that ladies don't like to talk about, but it's very, very common, and we do encourage you, if you're having a problem with vaginal dryness, soreness, to please get in touch, because there's lots of products out there that can relieve those symptoms.
Because I think you do have to be careful with a lot of these products as well, because some of the well-known ones that you can find in the supermarket shelf have often got colourants and preservatives, and actually sometimes can exacerbate the problem even further. So even a pharmacist, they're very clued up with this, and it's a lot bigger problem than what people presume it is.
Yeah. Definitely.
And again, we can help with this, and it is a huge problem. You can have, like I say, so many problems in different elements of your life, and that's what happens is sometimes is that relationships can suffer for something that really we have got a remedy for. You know, a lot of the cancers that we're discussing, what we're trying to do is minimise the hormone estrogen. But there is some scope as well with discussing with your specialist that some estrogen-based topical treatments can be used as well. Is that correct?
Yeah, what we would try and do is we would try and avoid the estrogen preparations initially, and there's products such as Replens, yes, that have no chemicals and they can help with the lubrication. But if a lady is so sore, and sometimes it's not nice to talk about, but they can be dry, they can tear, they can bleed. If the vagina is that bad, that we can discuss with mainly the oncologist or certainly that consultant and liaise with the GP and advise a short course of an estrogen pessary. And it's usually just a 3-month short term, because the estrogen in those pessaries will just be local to the vaginal area. It wouldn't affect your whole system, and your vagina will get a room back a bit. And then once she's kind of got back where she's comfortable and you're not sore, then you can continue using the other products that aren't hormonal based, and hopefully we can maintain some comfort for ladies experiencing this.
That's great, because I think that's the big thing as well in the message that we're trying to get across, is that, you know, yes, we've given you a tablet, and I think a lot of people are conscious that they're able to take that tablet, but it's the message is don't shut up about it, you know, tell somebody about it. There is often a remedy to some of these problems as well. Something as simple as something like a lubricant can make a huge amount of difference in a patient's relationship and just their own well-being. It can have an effect on your mood, huge as well. So if you're combining low mood as a consequence of the tablet and the irritation as well, it can lead to big problems. And you know, this is one of the other things, you know, when we're dealing with low mood, sometimes people look at fixes such as antidepressants and other things like that, but there is other ways as well that you can discuss with your specialist as well. And some things like exercise we're really trying to promote, because whenever we exercise we release a lot of feel-good chemicals, and these are the feel-good chemicals that sometimes the tablets suppressing. So, you know, we know how we feel when we go out and get a bit of fresh air and we, you know, get the heart pumping and things like that. And there has been a lot of research to suggest that that kind of exercise can, for low to moderate depression, can be just as good as tablets as well. Is that your experience of what you've found with sometimes when you've discussed with patients?
Definitely, Caroline. I mean, we know it personally when you've done a good exercise, or when you've run your first Great North Run, you're on the ceiling for days. But on a day-to-day, even a brisk walk, with the evidence there's a massive evidence now. So it's not just your general well-being that exercise helps to promote and maintain. We now know that exercise obviously helps to reduce your weight as well. And unfortunately, there is evidence to show that if a lady is obese, it can increase the risk of a cancer coming back. So especially in breast cancer. So we have the evidence now to try our best to maintain a healthy weight. So the exercise is part of that, and the other offshoots of the exercise is these endorphins that make you feel better, that have a knock-on effect with your mood, and it's a knock-on effect in your life. Full stop. It's not just related to cancer.
And bone health as well, isn't it?
Yeah, your bone health, your cardiac health. It's all linked with one system. And the basic things like doing daily 20-minute exercise. And sometimes I think if you're busy, you're looking after your children or your grandchildren, you're fitting in work life, it can become difficult. But it can be something as simple as, yeah, I'm coming home from work, but you could get off the bus, stop earlier. So you're building into your everyday life the best you can. And if you can't go to an exercise class, you're working from home, especially at the minute, perhaps you can kind of work on going up and down the stairs several times a day.
I mean, that's one of the things, you know, from working from home, I do try and avoid using the downstairs toilet, little things like that, so that you're using more muscles to climb a flight of stairs. Because again, you know, I am getting older, we're all getting a bit older, and one of the concerns with this tablet, and it's one of the reasons when you start on Letrozole that often your specialist will recommend that you go for a bone density scan, because it can affect your bones, it can weaken the bones. So exercises such as climbing stairs, some impact on the bones, can help repair bones and make them stronger as well. You know, we will assess the bones to see what kind of state they are before you start this tablet. And if we do see that there is a low bone density, they may recommend some tablets such as calcium or something called hyaluronic acid. But certainly we get a lot of complaints from patients saying that bony pain is one of the consequences of taking the letrozole. So again, exercise is great for the hormones, feel good factor, but mostly importantly is strengthening those bones. We don't want to get people through a breast cancer diagnosis in their 40s and 50s, and then as a consequence of taking the tablets and maybe not exercising and other problems, is then ended up with a broken hip. So if there is problems with your bones, you will be cared for with the osteoporosis team, and they can advise from that. But just making small changes to your diet, is that what the current recommendation is, isn't it? To maybe increase your calcium in your diet just to fortify the bones.
Yeah. I think what you mentioned there, Caroline, we know that the tablet doesn't give you osteoporosis, but it may make you more susceptible. So, as you say, any lady who's been prescribed the letrozole or any of the other aromatase inhibitors, or sometimes depending on the original cancer, some of our younger ladies may have similar drugs. The bone health is established by this DEXA scan, which is just looking at the density of the hip. So we're not looking at anything suspicious. It's just looking at how strong your bones are. The osteoporosis team, led by our sister Waters, who cares for our osteoporosis service, she would send out an appointment to the ladies. We do a blood profile looking at your bone health, and the osteoporosis team would look at those results in combination with the scan results, and that helps to establish whether a lady is susceptible to osteoporosis. And this may have nothing to do with the tablets, but they will look after the bone health. They will advise whether vitamin D, calcium is recommended, and like you say, whether a bone health tablet such as hyaluronic acid or the injection is appropriate. And they will repeat that scan, and it's usually about 3 years after the initial one, and this will help prevent any problems in the future.
So we are trying to strengthen the bones, and some ladies are just much more sensitive than other ladies with regards to bony aches and pains as well. I think when ladies first start going on it, I always say, give the body a few months to adjust to it. You've got to give it that time, but please don't just shut up and put up, would be my advice. If 4 months on and they were struggling to get out of bed because of aches and pains, it kind of defeats the purpose of taking the tablet in the first place. Again, would you recommend they ring the specialist nurses if they were on that kind of level with side effects, just to get some advice?
Oh, certainly. I mean, one of the things they could try is just having a couple of paracetamol next to the bed, because often the discomfort can be related to more of the joints. So some ladies that have actual bone pain, and other ladies have joint stiffness, and that's when the estrogen in the joints have it's almost like the lubrication, it's the oil in the joints, and if we're suppressing that, you can be quite stiff. So any lady going through menopause can wake up in the morning and feel like they're kind of hunched over, and their fingers and their feet are very stiff and feel creaky. And this kind of can improve during the day. But if you actually have pain before you get up, if you can take painkillers such as paracetamol, this can often alleviate that discomfort.
And I think it's important what you said there, that a lot of, it's the joints have synovial fluid around it. That's what keeps them nice and active. Going through and taking these tablets as well, you might notice that hot sweat. So, you're sweating a lot more, therefore we're losing a lot more fluid through our body. So that synovial fluid can sometimes take a punch as well. So if you are having night sweats as a consequence and bone pain, one of the other advice would be maybe to try and increase your hydration and your oral fluid as well. That might be, I think with when ladies ring up with side effects of this tablet as well, it's never just going to be one fix, is there? It's a bit like making a cake. It takes a lot of different ingredients to try and help, but that's one of the things. So if they've tried the fluid, they've tried the paracetamol, it's still no better. If they rang the specialist nurse or their GP, what advice possibly would we give?
In the first instance, what we would often do is stop the tablet. We've got to establish that it is the tablet causing it. Ladies are quite uncomfortable about it, and if they don't want to do that, they could actually just literally change the time of day that have the tablet. And that simple change can often make the difference. And if that doesn't work, we can have what you call a Tamoxifen or a Letrozole holiday, and they literally would stop it. Usually you would need approximately at least a 4-week break to let the tablet out of your system, and to see if those symptoms totally resolve.
Yeah, because I think an oncologist once explained it to me. It's a bit like rebooting your computer. So you switch everything off for a little bit, give it a little bit time to settle down, and then recommence taking it. And just that re-challenge of it can get the body better adapted to it. Is that something you've heard of?
Definitely, and ladies often find that beneficial. But one of the other things it does show is sometimes the symptoms don't go away, and some of, like for instance, the achiness in the morning, the stiffness, some people then realise actually that this is just normal menopause, and that they've associated it with the tablets because it happened at the same time. But there are many ladies out there who are on no medication, and their normal menopause symptoms can be joint aches. So it's good to establish, is it the tablet actually causing the symptom? And just the fact that having a break and re-challenging the body, often the symptoms aren't as bad. I mean, one of the other things that some of the ladies can do is, especially on tamoxifen, as you know, a very rare risk is that you can have a clot forming, especially if you've gone, say, on a long haul flight, because we know long haul flights there's a slight risk of what you call a DVT anyway. That tamoxifen can increase it, so some ladies choose not to take that tamoxifen a couple of weeks before they go on a long haul, and then wait a couple of weeks until after they come back. It reduces the risk of the clots occurring on their long haul stint. Usually it's a holiday, and they have this tamoxifen holiday, and that sort of once a year can often allow them to, like you say, reboot their system, and very little risk at all from a cancer protection point of view to do that.
And I think probably a tip I would say is if you've had surgery as well, those free stockings that you get courtesy of the NHS, it's worth just giving them a wash and a rinse through, and just wearing them if you continue taking the tamoxifen, and keep hydrated. A gin and tonic might want to be avoided during a flight like that, and maybe concentrate on getting as much water down you and moving as much as you can on that flight. It's just about minimising risk, isn't it? And make sure that you've got your letter there from your GP in customs just to explain what the tablet's there for as well. So thank you, Pauline. I think we've discussed quite a few of the side effects there as well, and there's some podcasts that you can also find that are largely related to menopause on some of the other podcasts that we'll have available as well. Just reminded that the duration of these tablets is sometimes a very individual decision from your specialist as well. And on the whole, generally, if you are taking tamoxifen at the current time at the minute, the recommendation is 10 years. And for letrozole, it is 5 years. But again, I must remind people that different cancers and different treatments can vary. So you will be advised how long you will be taking this tablet. Okay, but I think I just want to thank Pauline for coming along today and sharing our wisdom, and thank you very much, Pauline.
You're welcome. Pleasure. It's good night from him, and it's good night from her.